Hi, I'm Dr. Joe Niamtu, lovethatface.com, and thank you so much for tuning in. As you know, I'm a cosmetic facial surgeon in Richmond, Virginia. I only operate from here to here. I don't do boobs, bellies, and butts. I'm a teacher, an author, and a surgeon, and I love what I do. So today we're going to talk a little bit about something that wasn't a problem 15 years ago, okay? And that has to do with communicating with your surgeon or your surgeon's office via email or text, okay? So in many respects, that's been a great thing, is the digital progress in the ability to for me to see my patients, to FaceTime them, to look at a picture. In the old days, like the last century, 21 years ago, right? If somebody's called up and they said, hey, I have this huge swelling, I'm afraid, I'm worried it's a hematoma or this or that, you'd have to make a house call or go see the patient, your office or whatever. Now it's become so much more facilitated because we can look at pictures and actually talk to each other on our phone, our tablet, our watch, whatever. But sometimes it can be a problem too. And one of the big things that I see, and again, when somebody has surgery, they just want to have the surgery and the next day to look great. But we all know that that's not going to happen. And, really experienced and personable doctors prep their patients on what to expect. And, if you're going to have a facelift, it's going to be 2 weeks before probably you're going out. If you had something really important, a class reunion or a wedding, you may want to take 4 to 6 weeks. And it might take 6 months before everything really falls into place. So I don't ever mind answering questions from my patients. They have my cell phone. I'm available 24/7, and as a backup, my staff has the same. My patients have their cell phones as well. But some people get really impatient, and one of the things that, as a surgeon, that kind of takes the wind out of you a little bit is you do a procedure on a patient, and then 3 days later, they send you a picture complaining that they're not healing or they're not healed, or that this looks funny, or this is asymmetric or unbalanced. Come on, you got to give time to heal. You have to do that. Now, one of the things that's really interesting is how bad we can look when we take a selfie of our own face, especially without a flash, okay? So sometimes, after a facelift, a patient will send a picture and they'll say, oh, I've got this huge swelling here, it looks terrible, and they send this picture, and of course it's like, whoa, the picture looks terrible too. And I always ask the patient, look, get your camera, hand it to somebody else, let them turn the flash on, and let them take the picture. The reason is selfies are very distorted for a lot of reasons. Number one, there's actual distortion when you're trying to take a close-up like that. Number two, they're shaded. There's no flash in any picture that is taken where there's some dark areas. It looks 10 times worse than it is. Okay, so people take a picture under their chin and they say, oh my God, look how terrible that looks. Then they send me a picture and so this picture that I'm going to show you right here, all right, here's the picture that the patient sent. And by the way, this is a great patient, and I never mind that my patients communicate with me, but she said, man, this looks terrible under here. I had a facelift. I'm really worried about it. And, I don't know what to do. And, my husband's worried about it. And, I looked at the picture and I said, God, that looks bad. I said, again, look, this is a selfie. There's no flash. Let somebody else take the picture, use the flash, and here's what it looks like, okay? So you can see the difference, a selfie without a flash and a more controlled picture, okay? So first of all, let yourself recover. Don't try and push this. This is a big decision to have surgery, and you want to have a smooth recovery. It just takes time, and sometimes it's longer for some patients. But if you're going to send a picture, you got to make sure it's accurate, because it could change everything if your surgeon doesn't realize that you have this situation that's just inaccurate photography. All right, so that's a little hint how to communicate better with your surgeon. Thank you so much for your time. I'm Dr. Joe Niamtu, lovethatface.com.